Thank you so much.
KIIZA? Yeah, you have the floor, KIIZA.
Wonderful. Thank you so much for the opportunity to speak to this forum. I definitely would love to note that it's my first time to speak to the ACP and EU Joint Parliamentary Assembly, so it's such an honor, and I would definitely wish to take this opportunity to convey my message as follows. Well, we definitely understand what COVID-19 has done to the world. We cannot underestimate the sheer numbers of people who are really already tested positive. As of today, World Health Organization notes that over 180 million people have already tested positive in regards to COVID-19, and over 3 million people have died as a result. Of course, we cannot also underrate the mobilization that has been done all over the world to mobilize for the vaccine, and this has led to the vaccination of over 2 billion people all over the world. This is tremendous success in regards to the achievement that the world has done today as a result of joint efforts. But also, we cannot really undermine the challenges that exist today. And those are the challenges probably that we shall explore more in this conversation, and particularly in regards to how COVID-19 has affected young people, youth, and children, and if so, should they be able to access the vaccine? Should they be vaccinated? So honestly, for me, I would wish to follow science. I would love, of course, to note that I'm not a professional doctor. I would not speak in the details of science and data. But as a layman person, I would maybe just to say that I'm a lawyer, I'm professional, I'm a lawyer. So I would wish to speak in a more of public opinion in regards to COVID-19, vis-a-vis rather speaking on evidential and scientific proof. But with the limited knowledge that I have, just like many young people who are all over around the world, we know that COVID-19 can as well be dangerous in regards to our life. We can lose lives. We've seen our loved ones and people all over the world losing lives. But also we know that indeed there's a great percentage of people who get COVID and really, they recover naturally or through being administered in with different medical vaccination, or rather medical medicine that is already out there. So we know this. However, should we really make it, let's say, compulsory for young people to be vaccinated, and probably, youth and the children who should be probably 18 years and below? As of today, World Health Organization says children who are below 18 probably or 12 maybe, 12, because the 18 was the first. Now, as of today, they say 12, they shouldn't be considered as people, rather as people should be vaccinated, because there is limited information in regards to, to the testing and results that are related to how their bodies can withstand it. But for as of today, also, World Health Organization says those who are above 18, indeed, they should really have access to the vaccine. So with that, how has the vaccine been distributed all over the world? We well know that, of course, globally, continents have, disproportionately have access to COVID-19 vis-a-vis others.
KIIZA?
Just to wrap it up, I would think
Yeah.
that let's follow science. If indeed it's recommendable that young people should be vaccinated, let's mobilize resources using multinational institutions and agencies and governments to really have this vaccination, vaccine be accessible to everyone, regardless of their location and their race. And I would love to say, I think from what I read from World Health Organization, they say it's not vaccines that will stop the pandemic, but rather it's the vaccination. Thank you so much.
Thank you,
Over.
KIIZA.